Begin chapter. Along with her erratic blood pressure, Sheila's pulse was high, and we didn't really know if it was because she was not great at exercising or if it was from the alpha and beta blockers that the doctor had her taking. Yes, she was on both alpha and beta, which caused her a lot of anxiety and made her sleepy. Being anxious and tired was not a good combination for Sheila. The combination of beta and alpha blockers is usually given to people if they are at risk of heart attack. We knew that the use of beta blockers in this instance was to reduce the effects of hormones secreted from the adrenal gland and possibly hormones secreted from the attached tumor. My wife started finding issues that required medical attention when she was working at our school. Sheila had a tumor by her eye, and it looked slightly swollen all of the time. Neither Sheila nor I thought much about it. The tumor was present when I first met her, and I had thought it was barely noticeable. At the time, I did not realize that it was even a tumor. I knew that faces were never truly symmetrical, so I never questioned it. After we moved to San Antonio, from time to time individuals at her work would ask her if her husband was abusive. Why would they ask something like that? We never received a question like that when we were in the college in Laramie. Weird question, we thought. Maybe I looked mean, or maybe it had something to do with the apparent lack of personality in which Ron from college had commented. We couldn't quite figure out why someone would even ask such a thing. Could it be a community thing? We truly weren't familiar with San Antonio yet and wondered if spousal abuse was a community problem. Could it be that I really never liked to smile because I always felt that I looked silly when I was smiling? I have been told by students that I looked scary when they first met me. I probably looked like an old drill sergeant, but I never thought I looked like a bruiser. Then, one of the students at school mentioned the swelling near her eye when asking me if I was an abusive husband. Well, that was the final straw. It was time to go have the eye checked. We had asked the advice of our pediatrician at the time, and he recommended an ophthalmologist by the name of Dr. Donaldson. We made an appointment with this ophthalmologist that apparently was only one of very few doctors in San Antonio that specializes in eye issues associated with neurofibromatosis. Sheila and Dr. Donaldson hit it off well, primarily because he was the first medical professional that had in-depth knowledge of neurofibromatosis, and he had an amazing personality. He had ordered an MRI for Sheila, and Dr. Donaldson informed her that it truly was an NF tumor that he could remove. He also informed us that because of the fatty tissue of the tumor, it was so intertwined with other tissue that it may come back, and she might have to go through this operation again in the future. He had quite a few patients with NF, and it turns out that he would have 2 of our daughters as patients in the future as well. We scheduled the operation, and he removed the fatty tumor near the eye. He apparently got all of it the first time because it had not returned in 25 years. Interestingly, no one has asked her in the past decade if she has an abusive husband either. At least, I don't think anyone has asked. Dr. Donaldson also recommended that Sheila have an in-depth eye exam because he saw lymph nodules. When he looked at her pupils, there were tiny dark spots that are another telltale indication of having neurofibromatosis. Dr. Donaldson joked with Sheila that she had the textbook version of lymph nodules. In other words, they are so well defined that they could not be mistaken as anything else. He had wished that he had an intern available so he could share the discovery. We both were curious then, and he worked with a method with mirrors to show us Sheila's lymph nodules. The spots themselves are not an issue, but they are associated with other potential issues that require medical observation. Sure enough, after additional medical tests, Sheila was informed that she had tumors on her optic chiasm. This is a concern because everything the eye sees has to go through the optic chiasm to get to the brain to be interpreted for the individual to make sense of the picture. Absolutely nothing could be done with these tumors, and she received, at the time, a rather dire prediction. She was told that, more than likely, she would go blind sometime in her lifetime. Dr. Donaldson recommended another doctor for these issues, an ophthalmologist that specializes in glaucoma and vision field testing as well, Dr. Hernandez. The glaucoma may or may not be associated with NF, but any changes in the vision fields were a direct indication of growth of the tumors of her optic chiasm. The theory was that if the peripheral vision was decreasing, then tumors in the optic chiasm were growing and slowly impeding the ability to see. We were especially worried about what might happen as she went through a life-changing event as menopause. After all, having our first child caused something that we thought was a birthmark to stop growing. We were worried about what might happen when chemical imbalances occurred. So for her eyes alone, Sheila was subjected to MRIs and vision field tests on a yearly basis. The MRIs would be used to compare tumor growth, and the vision field tests would be used to determine if her vision was deteriorating. It very much bothered her when a research doctor at a neurofibromatosis conference had stated that it was not if she would lose her vision, but very likely when she would lose her vision, and she wanted to be prepared. We were devout with our yearly visits, and when the visits were required every 6 months, we made sure we kept those appointments too. I would drive her into San Antonio and home again after each appointment. After the field vision test, her eyes were always dilated. Sheila would go into the office for the appointment, and I would walk down the street for a coffee. This became a regular practice for quite a few years. As the time went on, both ophthalmologist doctors saw less and less change. Thankfully, when Sheila got to the age of 55 or so, they announced that she may, keep her vision during her entire life. Of course, there is some reservation with the announcement, because her vision fields may start changing again, or other issues might arise, but we are sure to count the small blessings as they come our way. Thankfully, after more than 25 years, Sheila was still able to drive and can still see quite well with corrective lenses. However, Sheila has not felt comfortable driving at night for the past 10 years. She never seemed to have good night vision, but it did seem to get a bit worse in the past few years, making extensive night driving too hard for her. The struggle to see at night could be a result of the aging process. The most recent vision fields were not narrowing, which suggests that she enjoys relatively good peripheral vision and is not getting tunnel vision. We are blessed in regards to this aspect of NF issues. The tumors appear to be stable, and a no-growth diagnosis is a welcome diagnosis. The blessings may seem small, but it was a significance to relieve some stress and worry in our busy lives.